How can we obtain accurate results in heart rate monitoring? We can use the Apple Watch for convenient and simple measurements, if your Apple Watch is loose or if you are moving around. Instead of remaining still as instructed, the ECG function may not work correctly. If you plan to use the ECG function regularly, you can add it to your watch face for quicker access to the application to measure an ECG. Ensure that your Apple Watch is snug against your skin. Then activate the application and press your finger against the digital crown. This completes the circuit across your body for measuring electrical activity. It's important to note that you must be sitting down with your arms resting flat on a table, without any movement, to ensure the accuracy of the measurement. Failure to follow these precise instructions may result in inconclusive results repeatedly. The ECG recording takes about 30 seconds, and you can view the real-time ECG readings on the screen. After completing the measurement using your Apple Watch, open the ECG Pro app and connect it to your Apple Watch. You can then synchronize your electrocardiogram ECG measurement data to the Pro app. Subsequently, you can view your ECG measurement records, detailed information for each record, and the generated trend analysis report on the ECG records page within the app. Additionally, you have the option to export the ECG analysis report as a PDF and share it with your healthcare professional to gain a better understanding of your cardiac condition. ECG stands for electrocardiogram, which is a medical examination method used to measure the electrical activity of the heart. The electrocardiogram records the electrical signals of the heart over a certain period of time, captured by electrodes attached to the patient's body. These electrodes convert the heart's electrical signals into a graphical representation, displaying the electrical activity patterns of the heart. The electrocardiogram typically consists of a series of graphical waveforms representing the heart's electrical activity at different stages. The main waveforms include the P wave, QRS complex, and T wave. By analyzing the shape, duration, and intervals of these waveforms, doctors can assess the cardiac health, detect potential cardiac issues such as arrhythmias, myocardial infarctions, and more. Electrocardiograms are a non-invasive, safe, and effective diagnostic tool commonly used in clinical settings to diagnose conditions, monitor a patient's cardiac status, and evaluate the effectiveness of treatments. An electrocardiogram ECG operates by recording the electrical activity of the heart. Here's how it works. Patients typically need to place electrodes on specific parts of the body, such as the chest, arms, and legs. The placement of electrodes provides different perspectives to comprehensively capture the electrical signals of the heart. Once the electrodes are properly placed, the ECG machine records the electrical signals generated by the contraction and relaxation of the heart muscles. The electrical signals are then transformed into graphical waveforms, forming the ECG. The ECG typically includes waveforms such as the P wave, QRS complex, and T wave, representing different phases of the heart's electrical activity. The P wave represents atrial contraction. The QRS complex reflects ventricular contraction. The T wave represents ventricular relaxation. Doctors assess the health of the heart by observing the shape, duration, and intervals of these waveforms. Abnormal waveform patterns may indicate heart issues such as arrhythmias or myocardial ischemia. ECG results can be used for diagnosing heart diseases, monitoring the effectiveness of treatments, evaluating surgical risks, and even detecting potential cardiac problems in the absence of symptoms. The basic waveforms of an electrocardiogram ECG include three types: the P wave representing atrial contraction, the QRS complex reflecting ventricular contraction, and the T wave representing ventricular relaxation. Abnormalities in the duration of waveforms may indicate heart issues, and different shapes may imply various cardiac conditions. Measuring intervals and segments involves observing the intervals between P waves, QRS complexes, and T waves, such as PR interval, QT interval, etc. Changes in these intervals may be associated with cardiac problems. Checking the heart rate, with the normal range being between 60 and 100 beats per minute. ECG consists of multiple leads, each providing a different perspective. Observing waveforms in different leads can offer a more comprehensive understanding Common abnormal waveforms, such as arrhythmias or myocardial ischemia, may suggest underlying cardiac issues. Combining ECG results with the patient's clinical symptoms and other test outcomes provides a more comprehensive diagnostic picture.